Hello guys, let's get this DNA viruses part 2 started. JoeyJohnsonDO.com, $3, you know the story. Alright, so we've worked on this side over here, and so just a couple things about herpes virus. I said I would review where they lie latent. So HSV1, and it lies latent in the cranial nerve 5, that's the trigeminal. So, and it causes cold sores, gingivomastitis, keratoconjunctivitis, pharyngitis, okay? And so that's cranial nerve 5. HSV2, that's going to lie latent in the sacral dorsal ganglial root. And it's going to, in dorsal root ganglia, it's going to cause genital herpes, neonatal herpes. HHV3, which is VZV, lies latent in the thoracocolumbar, DRG, and it causes chickenpox or shingles. Shingles has a dermatomal pattern. Chickenpox coagulates on the shrunken face, and they look like dewdrops on a rose petal. Zinc smear, multinucleated giant cells. Don't forget those. HHV4, that's EBV, lies latent in the B lymphocytes, causes infectious mono. Shows you're going to make sure it has heterophil antibody negative because it's mono nucleosis, so it should be heterophile antibody negative. Causes B cell infectiousness, and it has an asymptomatic shedding form of it in the of the virus in the urine. HHV5 is cytomegalovirus, and it is also going to be heterophile antibody negative, so that can cause a false negative for people thinking EBV. And it causes inclusion disease with owl's eyes, and it has an asymptomatic shedding of the virus, okay? And so don't worry too much about that asymptomatic shedding of the virus. That can be, I guess, kind of debatable on some things. So let's go on over here. Omas be bad. Those are your round ones. Don't forget your 2 omas right here we're going to go over. Also B for Hep B. Those are your cojones for the baby boy here. And then Bunya viridae, arenavirus, HDV or Delta virus. So slap cheek syndrome, okay? B19, B1 line, all the rest, remember, are going to be double-stranded in the DNA world except for pox virus. It's a complex capsule. It's the only one that's not icosahedral. All the rest are double-stranded and icosahedral, so these are the 2 exceptions. Pox virus is a complex capsule. It is double-stranded. B19, B1 line, so it's single-stranded, and it is icosahedral. It is not a complex capsid like pox virus. So, continuing on, let's talk about this. So slap cheek syndrome, okay? Slap cheek syndrome, you can remember that by the mnemonic slap, what it causes, okay? That's going to be slap cheek, okay? It's going to cause a low-grade fever. It's going to cause an aplastic anemia crisis, okay? Especially in the immunocompromised, and it causes prenatal infections. You can think hydrops fetalis, okay? And so you notice these 2 are going to be, they could be forming with sickle cell patients, hydrops fetalis, aplastic anemia. Think of that kind of stuff. You do a serologic test for this. Infectious erythema infectiosum is the other name for it. Do a serologic test, PCR test amniotic fluids, okay? It has nasal cavity transmission. Can cause a pruritic rash that begins on the arms and spreads to the trunks and legs in a lacy reticular pattern. That is how you ought to know about this. It has a lacy reticular pattern when it spreads. It's also known as fifth disease. Think about the slap cheek, the hands, pow, 5, fingers, fifth disease. Supportive care. I think that's about it on that we want to touch on. So next, let's go on to adenovirus. Adenovirus, pretty unique, pretty distinct. Alright, adenovirus right down here. Now, when we think about omas be bad, the way you're going to differentiate, remember that A there's for arenavirus, not adenovirus, is because adeno has DNA in the word. Look, DNA. So, therefore, you know it is not an RNA virus. That A must be an RNA virus, okay? And those are the 2 medical microbiologies viruses that are going to be relevant to us, or the only 2 that start with an A rather, is adenovirus and arenavirus. So adeno has DNA in there to help you out, okay? Think about that. We can remember it about the mnemonic adeno, okay? And so we have overt urinary bleeding. Alright, and so that's known as hemorrhagic cystitis. We got diarrhea. Okay, we've got airway transmission, causes airway infections like pharyngitis, febrile pharyngitis, by the way, so you do have a fever with this. Atypical pneumonia, common cold. You will have eye infections with this, so you're thinking conjunctivitis, and also you can have neoplasms to form from this. So that's adenovirus. That's about it. There is a vaccine, if you remember, that's typically given to the military. That's going to be in your mnemonics that we went over early. Go back and check those out if you don't remember. And so now let's talk about hep adenovirus. Okay, there's a good bit to talk about. HBV there. Alright, HBV. There's one of the cotonas right there, okay? Hep adenovirus. So the thing about this is it has reverse transcriptase, although it's not a retrovirus like your AIDS will be and all, but it does have a reverse transcriptase. It's typically parenteral transmission, so you're talking IV drug abuse, alright? Sometimes you'll see that written like that, IV drug abuse. You're talking also childbirth, unprotected sex. Now the thing about this, it does have what you're going to look for in hepatitis is to see if they have an acute and chronic form. This one does have an acute and chronic form. Only 20% will go chronic though, and I got that statistic from Pathoma video lecture series. Alright, and the chronic form can cause cirrhosis, carcinoma. Alright, and acute form is going to have more of your jaundice and your fever associated with it. Okay, so let's dive into this. The thing about this, you're going to give alpha interferon A to help with it. If you remember, alpha interferon B is going to help with multiple sclerosis. Alpha interferon A is going to help with Hep B and Hep C. Okay, so you can remember that by ABC. Alpha interferon A is going to help with Hep B and Hep C. Alpha interferon B helps with multiple sclerosis, excuse me, and I think of Miss B to help me with that. And so you're going to give HBIG to try to help prevent against this, okay? And so, yeah, 6 months is kind of the cutoff. Anything over 6 months is seen as chronic. Anything less than 6 months is going to be acute. And so the big thing about this is the serological markers, okay? So let's kind of dive into those. You're going to have the HBsAg. This lets you know, are you infected or not, okay? It's the first serological marker in the acute phase, and it's the first marker to rise. It disappears once it's resolved, and if you see it there for over 6 months, then you're talking chronic Hep B, okay? And so that's the things about HBsAg. That pretty much covers that. Hep B is chronic Hep B is defined by the presence of this over 6 months. So now when you talk about the core of Hep B, HB, the core antibody, Ag is for antigen, antibody generating, AB is for antibody. When you talk about the core of the antibody, okay, if you have IgMs against the core of it, that typically occurs in the first 6 months, okay? After the first 6 months, you're going to have kind of a latent period, and that's at the end of the battle, and so then it should develop into IgG produced then, and that indicates that you have conquered and won the battle. You're in a resolved state. Unless IgG is present for more than 6 months, then you're talking chronic Hep B. So basically, the windows which you have is you have an acute phase of Hep B, then you're going to have a window or a latent period to see if you've won the battle or not. And then at the end, now we're talking about chronic, and it can be chronic infectious period, or it can be chronic non-infectious period, okay? And then, of course, you can also be immunized against this. All right. So, continuing on, I think that'll help us as we go forward here, okay? So if you see IgG here during the chronic infectious or chronic non-infectious, whatever, then, you know, of course, that lets you know that, hey, this is a chronic form of Hep B. You won't see that if you get immunized because you didn't make the IgG, you were given it, okay? And so let's go on to other markers. If you have IgG against the HBs antibody, okay? Now, this is HBs antigen, don't forget. Now we're talking IgG against the HBs antibody. That lets you know if you've won or not, okay? That only appears in the recovery or in the immune state, okay? So you can get that in the immunized state or, you know, during the recovery state and everything, okay? That lets you know if you've won the battle or not. And so now let's go to the HBe AB and HBe AG. And, you know, you guys make sure that you look this up. If this is kind of confusing you some, I apologize. All right, HBe AG. Don't really have time to tarry on this one for a really long time, but I just wanted you to kind of get the basics of it. This is, I guess you could say, more pathology, honestly, but okay. So HBe, that's for the envelope, okay, and that lets you know if you be infectious or not. BE. do you be infectious or not? Okay, the E is envelope, and the way that Pathomus lecture series, Dr. Sitar talked about this, as he said that think about if you're going to send this to someone to infect them, you package it up in an envelope and transmit it to them. If it's not packaged in an envelope, it can't transmit. I kind of think of all the contents are coagulated in an envelope, then you're ready to mail it off to somebody and transmit it and infect them. If not, they're just laying around the house. All the stuff's out the envelope. Can't really transmit it. You don't have all the parts, okay? So basically, if you see this marker, this antigenic marker right here, then you know that the DNA is actively working and that there is an infective state going on right now, okay? And it has the envelope. And so it has not disseminated and gotten relaxed. It's ready to package out and go. This is the antibody of it over here. And so if you see this, then that means it is not transmissible. That's during the latent period right there. You have low infection, okay? Like the non-infective state right here of the chronic, you'll see it there, okay? You will see this during the chronic infective state. If it's, able to be transmitted, you'll see it during the active state right there, the acute state rather. You'll see the antibody when it's not transmissible, more in like the window state, chronic non-infective state, okay, and the immunized state as well. And so I think that kind of covers that. So let's continue on now to the Papoviridae, okay? Pardon all the pappies for being naked, right? Alright, so Papoviridae, we're going to have HPV, which is the human papillomavirus. Okay, so with the human papillomavirus, something tricky they could do with that. Okay, what is the most common bacterial STI? Most common bacterial STI is going to be chlamydia. Okay, what is the most common STI? Technically, it's going to be HPV. Okay, so just watch out for that. Chlamydia is usually concomitant with gonorrhea, don't forget, okay? And so let's talk about HPV. So the thing about HPV is you have different serology types, all right? You can have this acute form causing warts, and if you're talking about skin or plantar warts known as verrucae, then you're talking HPV serologies 1 and 4, okay? If we're talking HPV causing genital warts, you're talking about HPV serology forms of 6 and 11, okay? And that rarely progresses to cancer. This is a low-risk type, okay? Now, if we're talking HPV that's getting in the airway, then you're talking 6 and 11 as well, okay? So, once again, I just want to highlight that's low risk, and we're talking about the same serology you're going to find, all right, that causes genital warts, the same type are in the airways. I'm not going to get into how that happens. You can use your imagination, I would imagine, the same as how gonorrhea can also cause pharyngitis. Continuing on, and also how HSV 1 and 2 also you're starting to see them cross in the oral area and the genital area. So, when we're talking genital warts that can become carcinomas of the cervix and penis, you're talking about HPV serology type 16 and 11. Okay, the high risk types of HPV are going to be 16, 18, I said 11, I'm so sorry, I meant 18, sorry. So 16, 18, 31, 33 are seen as the high risk types that can cause cancer, and as a matter of fact, that's why we will have Gardasil that will take care of 16 and 18, also take care of 6 and 11, okay? That's what Gardasil will take care of. And so you can get HPV through skin-to-skin contact, sex, birth canal, microscopically. You could look at this. It typically has a form of cauliflower. It has a cauliflower-like appearance, okay? And there is a vaccine against it, Gardasil, and you will see coilocytes on it microscopically. So those are going to be just abnormal-looking cells. Look that word up. Look up what coilocytes will look like, okay? And so now let's go into the polyomaviruses. That's going to be your other cojones, if you remember, right there, okay? Or within that of your Papoviridae, you have polyomavirus and papillomavirus, okay? I said the other cojones, but I meant the other one that's included in the Papoviridae, okay? Polyomavirus, you've got the most famous one, which is JC virus that causes progressive multifocal leukoencephalopathy, and that's the initial infection sites in the tonsils, and it goes into the GI tract, lays dormant, and then it goes to the kidney epithelia, and it sheds viruses in the urine, crosses the blood-brain barrier, goes to the CNS, and affects mainly the brain. So you can remember JC for junkie cerebrum. The other form of this is going to be the BK virus, and you can remember bad kidneys for that because it's going to go down and infect your kidneys. It infects kids and the immunocompromised. There's no treatment available for that, and so that is your polyomavirus. So you have the junkie cerebrum form. You also have the bad kidney form. Thanks a lot, guys. That was your DNA viruses, and please remember $3. Thanks a lot. Bye-bye.